Good evening, friends. Welcome all to our Facebook live session. Before I start, I and the entire team, Zenith, would like to wish all of you a very happy Mahashivratri. May the divine energies of Lord Shiva always be there to bring a lot of positivity in your lives. On that auspicious note, let us begin with the part two of our male infertility series. We already introduced this session in our previous, or rather, this topic in our previous session, where we spoke about the basic concepts of male partner infertility. We also discussed about how the incidence of male infertility is on a rise among especially population among the urban populations, and the reasons are many. I think we already spoke about a few reasons before, but today basically we will be talking about a few signs or warning signs or basic understanding as to how a male infertility can show up in a male partner, and what needs to be looked at primarily. I am Dr. Pallavi Kalghatgi, a consultant and fertility specialist at Xenith Advanced Fertility Centre. And we have with us today our expert, Dr. Mamta Dighe, Director and Chief IVF Consultant at Xenith Advanced Fertility Centre. Let us get Dr. Mamta on the screen. Yeah, she's here. So,
Hi, Pallavi.
hi, ma'am. Good afternoon. We happy Mahashivratri. Today is a very
Oh,
auspicious
yes,
day.
wish you the same.
Yeah. So
Absolutely.
yeah. So today basically is the part two of our male infertility series, and we'll quickly, we've already a little delayed, so let's quickly start. We are going to primarily be talking about what are the warning signs, what are a few symptoms that a male or a couple can, notice during
Right.
this. So let us quickly begin. I think previously in our last session we had already spoken about the causes of male infertility, where idiopathic seems to be the most having the higher incidence, and varicocele infections and so on. But can you quickly tell us a few warning signs or symptoms that male partner could experience in infertility?
All right. So I think thanks for that question, Pallavi. I think the main reason we are having this series on male infertility is because most of the times there are no warning symptoms or signs, and that is why things are missed. And the issue is that most of the times, especially as far as fertility is concerned, both in females as well as males, if you can detect the cause and the problem earlier on, you can treat it and get away with milder forms of treatment compared to when it is detected late, and hence you have to move on to more and more advanced treatments. So what I'm trying to convey here is that most of the times there are no symptoms or signs that the male faces. And in fact, people come to us often because of symptoms which they associate with infertility, but actually is not related to infertility. For example, if there are erectile issues or ejaculation problems, sometimes these issues are present. These are a part of sexual dysfunction, but they do not correlate with infertility. So in terms of his reproductive capacity, in terms of having good number of sperms with good motility, etc., this man is perfectly normal and healthy but has other issues. So the crux of the matter is most of the times there are no symptoms. But however, having said that, if there are any sexual dysfunction signs like ejaculatory problem, ejaculation problem, erectile dysfunction, if there is obesity, if there is gynecomastia, that is, if there is increased size of breasts in the man, um, all these signs, if there is a history of a lot of smoking, alcohol consumption, all these things could probably tell a man that there could be issues. Also, if there has been previous history of mumps during the adolescence age, if there has been history of trauma around the testicles, if there has been history of undescended testes as a child, all these past things, if there has been history of tuberculosis, especially abdominal tuberculosis in the male partner, all these things can sometimes alert you towards a problem. If there is pain in the testicles, again, that is also one more cause of one more sign that could alert you towards what you need to do. If nutrition, sleep pattern, food habits, everything is not good, history of lot of stress, again, these things can alert. But there could be, or sometimes there may not be any symptoms or signs which could alert you towards the fact that a male infertility problem exists.
Okay. Actually, that was going to be my next question. If like you said, having a sexual dysfunction or having unable to maintain the erection, all of these things that we commonly face among our in our OPD patients, does that mean the partner is infertile? And you've already answered that. But then come, let's say he is suffering from both, like he is also giving us a history of having a sexual dysfunction, and in a coincidental way probably he got his semen analysis done and that was abnormal as well. So in that case, how would you handle this case, or how would you treat it, or do they need to be treated simultaneously?
All right. Okay, so I'm going to give a bit of a long winded answer to this question. I will also address the first part of the question, which, I kind of addressed in my answer. So, the first thing is we need to understand that a sexual dysfunction, like an erectile problem or an ejaculation problem, can lead to infertility sometimes, because if there is no erection and there is no ejaculation, it is going to become difficult for this couple to conceive naturally. However, it does not mean that this man is infertile. This is becomes a part of the sexual dysfunction which can contribute to infertility because they will not be able to conceive. But it's kind of not infertility because we define infertility as absence or no pregnancy after a year of unprotected intercourse. So if you've not had intercourse, we can't really call it infertility, but this can lead to the problem of not having a baby, and therefore it needs to be treated if one has to conceive. Another thing is we see very often that even for problems like erectile problem or an ejaculation problem, sometimes we immediately resort to infertility management. That means if there is a sexual dysfunction, what we advise is sometimes just, okay, let's plan an intrauterine insemination. That is when the man can just give many times. If you take a very very detailed history, there is a possibility that a vaginal intercourse is not possible, but it is very possible for this man to give a semen sample by masturbation. That happens very often in practice. So these men can give us a semen sample to assess the semen analysis, but many times vaginal intercourse for them does not become possible. So when you approach such patients, first is you have to rule out any systemic problems like diabetes. The commonest is diabetes. Any other trauma in that area, any psychological problems, psychosocial problems that could be arise, any emotional issues between the couple in order to address the sexual dysfunction. Once you have ruled out all the issues that history can give you, also with certain investigations like a scrotal ultrasound or a scrotal doppler, you need to assess that everything, the reproductive system in the man is working well. We also do some hormone tests to assess whether there is any hormone dysfunction which is leading to this kind of problem. But once you have assessed that, let's say, like for your example, for your question, that there is sexual dysfunction and there is male infertility as well. That means there is sexual dysfunction, but you have also assessed the semen sample and you have found out that the semen count or motility or morphology or everything put together, there is an issue with the semen sample. Then the next question is, how do you handle such patient? Do you just treat the sexual dysfunction, or do you treat the infertility? Now this is going to be dependent on the couple. It is very individual. It also depends on the female factors. So let's say there is a male factor infertility associated with sexual dysfunction, and the woman is slightly older. We are thinking that there is lesser time where we need to act faster. She probably has slightly less number of eggs in her ovaries. Under such cases, we would probably start treating both together. That is, counsel them, ask them, whether they would like to proceed with an intrauterine insemination. At the same time, try and start treating them regarding the sexual dysfunction. However, if it is a couple who's been recently married, it's a young woman, her complete reproductive potential and all her reports are completely normal, there's absolutely no need to rush into managing the patient with some kind of treatment. Of course, that will also depend on what kind of male factor infertility it is. Like, for example, if there is severe male factor infertility, then you know that irrespective of whether you treat their sexual dysfunction or don't treat it, they will anyway require assisted reproductive techniques. So I would, to cut a long story short, I would say that this is very individualized. You have to put all things into perspective. If there is sexual dysfunction associated with a severe male factor infertility, you would definitely counsel them and tell them that it is best to proceed with the management as early as possible. If there's mild male factor infertility with associated with sexual dysfunction, you can try and correct the sexual dysfunction. You can try and treat the male factor infertility and then see whether this couple can just go ahead and conceive naturally.
Okay. Yeah, so exactly the point. I think it is a very individual approach with all of this. It makes more sense to look at a couple, at the situation, at the age, very individually before considering the right treatment for that for the couple.
Right.
Um,
So, Pallavi, yeah, sorry to interrupt you. I always tell my patients that, this whole thing of infertility is like a jigsaw puzzle. Every piece of that puzzle is is so important to fit it in properly. So only then can you see, even if one piece is missing, you will not get the complete picture. So many times, nowadays, it's okay that people have started looking into male factor and semen analysis. But when I started practicing infertility, which is about 24 years back, about 24 years back, um, even for people to even interpret the semen analysis report was a problem. They would just look at the count and say, okay, my count is 20 million, 25 million, it's fine. But it's never like that. It is the count, the motility, the morphology. And of course, we have come a long way since then. But similar to what we used to do about semen analysis, we have to make sure that every case is individualized and then we fit those pieces properly so that the picture is completed for that particular couple.
yeah, yeah. We had, I very briefly remember this, but a man, he got evaluated beforehand. It was a normal semen analysis, but I think about later on he developed a trauma, or he had a surgery to his inguinal region, in his testicular region, and he came back for a later at a different occasion with an abnormal semen parameters, and that's what he came to say, that I was absolutely fine. Now, how did this happen? So, I that is a very important question. Does You already mentioned about testicular trauma, but what about any surgeries or any hernia or surgeries that usually a male undergoes? Does that have any effect on the human parameter?
See, the commonest reason why a surgery in that area can affect is if there is trauma and if there is healing with fibrosis. Whenever you heal, even if you get a little bit of cut, you see that there is kind of a thickish, kind of a scar tissue that you form on top of it. So when there is healing with fibrosis, what happens is that the tubes that carry the sperms from the testis into the semen sample when you ejaculate, many a times those tubes may get affected. They may get caught in the fibrosis. They may get affected during the small surgical technique. Rarely, if the surgery is done well, usually it's not that the testis suffers a lot of damage and then suddenly stops producing sperms. That doesn't happen very often. But the tubes that carry, that we call the vas deferens, can get affected during that whole process of surgery. And of course, if not, if there has been a lot of bleeding and there's been a lot of dissection around that area, other things can also, the testis also at times may get affected, but mainly it is these tubules. And then what happens is that the testis keeps producing the sperms, but the sperms are not brought out into the semen sample through these tubules. And then the man may present with something called azoospermia. That is, there are no sperms found in the semen sample, but this is a form of obstructive azoospermia where the testis keeps producing the sperms, but because of the damage in the vas deferens, the tubules, the sperms do not come out into the semen sample. So, yes, any past history of trauma, any accidental injury, any surgeries in that place needs to make you aware that these issues can exist, because it's not just finding sperms, it's understanding why sperms are absent.
Yeah.
So that is also a very important factor, because we are dealing with a pregnancy here. We just don't want sperms. We want viable sperms which will be able to go ahead and lead to a healthy pregnancy. So it's very important to have all these facts, this history in your mind, because then you can apply them and then see what kind of a treatment will help you get the best quality of sperm, which leads to a viable, healthy pregnancy.
I think then that is very relevant to a positive medical history as well. So, especially I think in diabetics, the and in hypertensive male as well. I think so. So, how does that affect the semen parameters? So, especially in diabetics, because insulin resistance and the current lifestyle that most people are leading nowadays, obesity, and with that, diabetes and type 2 diabetes is very prevalent. So, how does that affect the semen parameters?
Yeah. So I think we are the diabetes capital now. I think India
Yeah.
has already surpassed China probably in terms of being the diabetes capital, both males as well as females, and a lot of younger individuals have started to have, problems with their glucose tolerance and have a pre-diabetic condition. Now, again, what we need to understand is that how diabetes affects is mainly through affecting the blood flow to the testis. So, very often in diabetes and hypertension, it is the blood vessels that get affected, and hence the proper oxygenation of the testis gets affected. And this can lead not only to infertility, but one of the other common causes of sexual dysfunction is also, like erectile dysfunction, is also diabetes. That's the commonest things that, we check to see in the Dopplers and stuff like that, whether the vessels have been affected. So all these lifestyle issues can definitely have a problem on the semen parameters. Now, this is again anecdotal, Pallavi, but one other thing that people ask me often is, how important is the effect of stress? And it's very difficult to quantify stress. And what do you say? You have to say that definitely there is an effect and there are studies, but it's really difficult to quantify. And I remember one of our patients, he had a perfectly normal semen analysis about, like about 3-4 months back. And then we were planning some treatment, but they were going outside, and then they came back. And then one day when he came and gave a semen sample, the count was 2 million. Okay, so it was a very, very low semen count.
Yeah.
And I was actually a little shocked. I said, okay, what has happened? Did you go through any surgery, any other issues during these last 4 months? And he said, absolutely nothing. Then he said that, but there's a lot of stress at work, and I'm like just staying up overnight, and I'm having calls, and it's across continents, and it's getting very difficult. And I said, yeah, okay, but I don't think that will, take your semen count from being normal to making it 2 million. And he said that, let me just settle all this and then we'll repeat. I said, of course, let's do that. And he repeated his count, about a month after everything had settled, and it had actually come back to normal. So this is
Oh,
very anecdotal as far as
yeah.
I'm concerned. I haven't seen many, very many cases like this, but I've actually seen this happening. So
Yeah.
all these lifestyle factors, all environmental factors, see, everything that we are calling idiopathic, that we don't know why it's happening. Global warming could be the reason, temperature increase could be the reason, pollutants could be the reason, what we are eating, what it is covered with, the pesticides that we are putting into our gut, all that could be the reason. We really do not know. So it's very difficult sometimes to quantify everything. But yes, all these make a huge difference on the sperm count and motility. Having said that, there has been a study where they have monitored a man with normal semen parameters over a course of 2 years. And he was asked to give his semen sample every week in those 2 years.
Okay.
And they found that his semen count varied from 4 million to about, you know 80, 90 million. So sometimes there can be such a huge difference in the semen samples.
Yeah.
But if you consistently get a report which is low, obviously it is a low. And any parameter, any single parameter which shows a low sample has to be checked again. So most of the times we always try and do two semen analysis. That is why it is always recommended that irrespective of what it is, especially if there is a problem in the semen analysis, get two semen analysis done before you actually quantify and say that this is a problematic semen sample or it is a normal semen sample. But yes, we are seeing a lot of male infertility on the rise. And so, if there is a decrease in count, motility, morphology, whatever, you definitely need to assess.
Yes, yes. Yeah, actually, you really can't, understand how stress impacts our lives. So we just get through each day, with carrying a stress. I mean, all of us are stressful. That's what I would say. But how it affects our body is actually quite. In fact, I've also heard that when especially in when you're working IT people, they are working with their laptops on their legs all the time, and those radiations, the phone radiations that when we place it in our pockets, they actually send out radiations to the gonads. So at some point, even that has an effect somewhere in the count and motility. So moving on in
Absolutely.
yeah, yeah. So in that case, if you say that most of the times it is asymptomatic, would you recommend getting evaluated? I mean, the male partner should be getting evaluated at regular intervals, or what would be your assessment as to how should a male partner get evaluated, or like semen
See,
parameters?
Frank,
Yeah.
See, frankly, I think that if a woman is less than 35, or I would say in our setting, less than 32 or 33, and they have not tried enough, there is not real need to go on assessing everybody's semen analysis, right? But if they know that they have tried enough, if there is infertility, older age, or sometimes even at a younger age, um, you feel that you can sense sometimes that we have tried enough and there is no pregnancy, then first and foremost you must get one semen analysis done. Usually, we would always get two semen analysis done. But if two semen analysis are completely normal and this patient is not really requiring any other treatment, I would not go on saying that, keep evaluating your semen analysis over and over again, like every 2 months, 3 months, or 6 months, or whatever for that matter. Unless, of course, a treatment is indicated in them. And then, if they're going through some treatment like intrauterine insemination or IVF or whatever, automatically the semen parameters would get checked, because I personally feel that we are already doing too much. Even couples, when they're planning a pregnancy, they're constantly trying to monitor their ovulation period, with those several apps that are available, or with their ovulation kits. So on one hand we are saying that we should not add to stress, and on the second hand, if we keep saying keep doing your analysis, keep watching this, keep watching that, I think it would add to more stress. So I would not really recommend testing again and again if the semen analysis is completely normal. Yes, if you spend adequate time again trying, and let's say after 6 months to a year, after that also there is no pregnancy, then maybe again you can have a semen test done. But otherwise, on a routine basis, it is not necessary to keep testing the semen again and again.
Okay. Um, Okay, so I think that was a lot of valuable information today. Let us quickly check if there are any questions in the comment section. Okay. Okay, so I think there's nothing. Actually, I had a quick question, Dr. Mamta. I think this is very important because we have a lot of you know men coming in and asking to get their analysis done, but they're not comfortable with getting it done in the clinic for again various reasons, performance issues, and they're again stressed. So what how would you say would be an ideal way to collect a semen sample, and is there a way where we could let them get the sample taken from outside and bring it in? So what would you say about that?
Okay, a couple of things is why we tend to, for that matter, collect the sample at the facility is because one is that the sample needs to be collected properly. Second is it needs to reach the facility within a stipulated amount of time. Otherwise, you will get a problem with the motility count, etc. And then it will lead to a wrong reporting of the semen sample. So, an ideal way would be collecting the semen sample in a facility where there is provision of, a private, secluded area and a room for the man to collect the semen sample by masturbation. I think that is very important. It is important to make sure that the penis is cleaned just with water or saline before giving the sample. But at the same time, it is also important to make sure that the container does not have any water or even a water droplet. The container needs to be dry, because presence of water will cause the sperms to die, and we'll not get a good a proper semen analysis report. So you need a dry, sterile container that into which the semen sample has to go, after making sure that it is completely, there is no water content over there. This semen sample has to reach the facility immediately, as soon as possible. But if not, then within half an hour of collection. And that is the issue. I think there are two issues collecting at home. One is that sometimes the proper hygiene is not maintained, or the proper, dryness, the container, making sure all those are not maintained at times. Second is getting it to the facility in time sometimes can become a problem. And the third issue that we sometimes have, especially if it comes to treatment, is you have no control from where the semen analysis is coming, right? I mean, where the semen sample is coming. It is just based on the sample coming into the facility and the word that the person is giving, that yes, this is a given sample. So sometimes, it can lead to medico legal issues. So that is why, in order to circumvent all these problems, it is always better to collect the sample in the facility. And especially when it comes to treatment like intrauterine insemination or IVF, because you're going to use the semen analysis to, give a baby, or, form an embryo. And hence, it is always better to do that. But if not, then collect the container from the fertility center, take the proper instructions, collect the semen sample in the container, and make sure that it is brought to the facility within half an hour.
Okay. Okay. Yes,
And
that
most of
was.
the centers, sorry, most of the centers now have a proper semen collection room, and, a
Yes.
place where they can go. So I think I would still say always preferable to do it at the facility.
Yeah. Absolutely, that makes a lot of sense, and I think this was a very informative series. I think primarily awareness is a very great agent for change. So we need to being aware actually helps us to diagnose anything, and like you said, a small thing early, but it increases our scope of treatment. So this kind of awareness is very important for every couple to notice a few things, a few changes in their body, which will actually save a lot of time and effort and even money in their entire treatment.
That's true. That's very true. And I also feel is sometimes, what we think are the big issues
Yeah.
are sometimes not the big issues for a lot of people. It's the small things, am I eating right? Am I sleeping right? Like the commonest question that you get even during a pregnancy is it okay to lie on my side? Is it
Yeah.
okay to lie on my back? So
Yeah.
you are thinking of all complications, and growth of the baby, and all these new parameters and machines with which you're going to monitor. But what is of concern to the mother is, am I eating right? Am I sleeping right? Is there anything I can do at my level? Okay, when you come to a clinic, you know that okay, the doctors are going to do something, but is there anything that we can do at our level to
Yeah.
either make sure that we maintain our health, that we increase our health? And health could be general health, reproductive health, whatever health. And I think those are the small things. And if you can, uh, give these minute thing and nuances, I think probably it will help a lot of people. And if we can decrease the burden of infertility that is falling on people more and more now, I think we would have done our job with our FB life.
Absolutely, absolutely. In fact, we are actually open to, suggestions or some feedback where if there is something that needs to be spoken about more, or the pattern in which we are doing it, if that, some improvement there, we're absolutely very open to suggestions, because the whole idea and purpose of this FB live is to talk more about these issues and spread more and more information and spread more and more awareness. So that is, I think that is a very good note to end this session. And our next session, that is again a continuation of our male infertility, is going to be on 4th of March. So we will be coming up with the updates as to what is the topic and who's going to be our expert talk. And we are going to be coming up with all of that. But please, all of you, stay tuned and continue to like and subscribe and follow us on the various social media platforms. We are on Instagram, we are on Facebook, we're on YouTube. So please follow us so that you get more updates. And we are happy to come up with a lot of such sessions where we get to talk more and more about reproductive health. Take hold of the talk and you make it more and more interesting with your personal experiences. It brings a lot of depth to the whole matter. So thank you, and we'll see all of you uh, next time on 4th of March. Do you have anything to say, Dr. Mamta, before ending?
No, that'll be all. Lovely, lovely. Just talking and discussing some things. It's always nice. So thank you, Pallavi, and thank you everyone for either watching it now or watching it later. And like Pallavi said, we really would like to know what you think, what you feel, if there is any specific topic that you would like us to address, because I think that really helps us to formulate things which really will appeal more to people who have concerns about this. All right,
Absolutely.
thank you and have a good weekend, everybody.
Bye. Bye.
Okay, bye bye.